So many of our patients come in and the big concern is looking over-injected, overfilled, or really not knowing what treatments they need. We're super excited because we now have our new EA Beauty workbooks, and this series of videos is actually going to go through how we do the full assessment. You can also get your free download. We'll include that in the description below. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now, and I've been building my business here at External Affairs Medical Spas for the last almost 25 years. My family started this business many years ago. Our specialty is beauty and regenerative medicine, which means that not only do we want to help people look and feel great on the outside, but we also want to start on the inside and really look at things like hormones and nutrition and all of those things that go together. The purpose of our videos is to educate people better when it comes to these procedures. So many clients have fears, and by producing better content, we're hoping that we can alleviate some of those fears. We really appreciate your feedback, and we want to know what you want to know. So please pop your questions in the comment section below, and we'll make future videos to address your questions. Hello everyone, and welcome to our video series on the EA Beauty system of assessing an entire face and skin. We've got our beautiful model here. Sherry, thank you so much for being with us. I'm going to walk you through the whole process of how we do a full, thorough assessment. And for our clients at home, we'll actually include the link to the EA Beauty workbook. You can download it and either follow along, or you can print a copy and start that process yourself at home. So the first step in the EA Beauty assessment is to have our patient fill out their portion of the EA workbook, and then that just gives them an idea, before they're coming into the clinic on what their concerns are, and maybe kind of nailing it down a little bit. Okay, so the second step to the EA Beauty assessment is once the patient is in the clinic, we go through all the paperwork with your medical profile. You already met our medical director, and now you're going to meet with one of the nurses, myself, and I'm going to do a thorough assessment including measurements, skin assessment, 3D pictures, 2D pictures. We're going to go through all that. But before we start that, I'm just going to turn you, Sherry, and I want you to look in the mirror. And I want you just to tell me in your own words what your concerns are.
First of all, is this indentation by my nose, the lines across my forehead, this area here above my lip, below my lip, and also these little bags underneath my eyes. And I'm not sure if you can do anything with that, but okay, those are the main.
Great, that gives me an idea of what your concerns are. When we start our thorough assessment, we'll actually go through and I'll show you, which areas are actually lacking volume, which areas we can treat with fillers or with a toxin. We'll go through all of that as we do our assessment. Okay, so Sherry, I'm going to take 3 pictures with our 3D camera system, and what it's going to do is it's going to crop you and turn you into one 3D image, and then I'll show you on the computer what we can do with that picture and all the different things that I can show you. You can see in here that you've got substantial volume loss in the top part of that cheek. So if I put filler along the bone here, that's actually going to pull and tighten. It will actually make the under eye area look a lot better. We can check on you in a few weeks to see what that looks like. We can put filler under the eye. It's kind of the last thing that we want to do, and I think for you we can achieve a beautiful result with the filler in through the cheek. So when I use the calipers along the lip line and the chin, if I do this again, you can see that volume loss, definitely in the lower lip. And here's that angle again, in that jaw. So we're going to create a much softer looking jaw. The next thing I'm going to show you is how this software system can assess your skin. So many of our patients come in and they're concerned about the color of their skin. Many patients don't realize that it's there. So typically what you can see on the skin, it's kind of the tip of the iceberg. So we can see, definitely some darker marks here. And unfortunately, if they're left untreated, they just get darker and darker and darker. So we talked about a photofacial. And we're going to do that for you just to even out that skin. That'll be beautiful. A more even skin color is also considered very youthful. We can also look to see if there's any broken blood vessels, and you don't really have this problem. Sometimes people that are lighter skin toned, Northern European, sometimes they get the broken blood vessels. I tease our patients and tell them that everyone gets something. So based on your genetic heritage, how your skin ages, we all get it, but we're going to treat it differently based on that. So Sherry, we're going to use a set of, they're called 5 calipers to do a series of measurements. And what these calipers do is they measure a 1 to 1.618 ratio on different areas of your face. Now, this is exactly what Leonardo da Vinci used to create all of his masterpieces, just to make sure everything is in proportion. So we're going to do a series of measurements on you. I'm going to get you to close your eyes. You can just look straight ahead. And the first measurement that I'm going to take is the distance between your eyes, which is called the intercanthal distance. Great, and you can open your eyes. So now this is the distance between your eyes, and now the calipers automatically adjust to that ratio. So we're going to use this to measure a series of things. So I'm going to start with your eyebrows. We're going to look at, where the eyebrow should start and where it should peak. We're going to measure the length. We're also going to measure the height of the eyebrow. So the tail of the eyebrow should be slightly more elevated than the head. And as we look closer at your picture, sure, we're going to talk about your eyebrows, okay? I think that I see beautiful eyebrows coming. So the second measurement that I'm going to look at is the nose, alrighty? I'm going to use a flat edge just to look at the nose and the straightness of it. We can also look at the length. This area sometimes can be treated, not our favorite thing to do with fillers. Sometimes if something is really off, we'll send you off to see a plastic surgeon, but your nose is beautiful. The third measurement that I'm going to look at is the temples. So we actually put the straight edge along the temple here to see if there's any temporal hollowing. And on you, you do have a slight hollowing just starting. If the concern starts to be that the brow is falling down, a lot of times we can look at that temporal hollowing and see that the fat pads are becoming deflated in that area, and that's contributing to the drop in the eyebrow. So we can put filler in there and get a little bit of a lift. The next measurement that I'm going to do is the jaw. So when we open up our calipers, this curve is called the Fibonacci curve. So it's in nature, everything that's beautiful has this curve in it. If you look at a seashell, that curve is there. When we're looking at the jaw, what we're trying to do is create this beautiful soft curve. When I look at your jaw, one of the things that I'm seeing that is kind of congruent with what you said is you feel like this is dropping. And it is. That's what happens is the fat pads that are up through this area, they start to become deflated, and that's what holds the cheek up. So we start to get a drop here. The other thing that happens is the chin starts to come up. So we're having the chin come up and this drop, which creates a little bit more of a squared off look. So when we're using fillers, we actually want to lift and pull back here, possibly back here in the jaw as well. I'll just turn you a little bit. Maybe pull back here, and then also extend. And so even though we're not actually treating this area, we're treating around it. So we can get a pull, and a drop here. And that'll work more towards that beautiful soft curve. So one thing that we do like to point out, of course, in the clinic, if I just turn you a little bit sideways again, is that when we start to see kind of draping of the skin in here, and on here, we are obligated to say that possibly, facelift sometimes would better serve you. I think for you, we can get a beautiful result with the filler, but that's just something to keep in the back of your mind. So the next measurement we're going to look at is your forehead. I'm going to use that Fibonacci curve, and we're just going to place it along. And so when we go like this, we can actually start to see where there's volume loss in the forehead. And on you, there actually is some volume loss in around that area that you expressed concern in through here. So we can put a little bit of filler here to bring that area out. We want to be very, very careful. There's some super important arteries that run up through here, so we'll be quite cautious. The other thing that I will mention when we look here, this was an area of concern for you, is these lines here. So the lines were caused by muscle movement. So we can certainly treat that with a toxin, and we will do that today. We'll actually use Dysport to relax the muscle. But the one thing that we need to point out on you is that those lines, they're very deep now because they've kind of been left untreated. So they can create scars in the tissue, which those don't just magically disappear with a toxin. Sometimes repetitive treatments will smooth them out. We can put a tiny little bit of filler in there, but again, it's a high risk area just because of the arteries that run in behind. So we're going to look at the chin, and I'm just going to take the measurement from the base of your nose to the middle of your lip, from the middle of the lip to the chin, and we want that to be in that ratio. The other thing that we're going to do now is we're going to look at the lip and the chin together. So we're also going to look at the alignment of your chin to your lip. So if I take our flat edge here, Sherry, and just place it gently against your lip and your chin, we can see that she definitely has some recession in that bottom lip. So we do want to bring that out. You can also see this flat spot here, which is indicative of this pulling up. So we're going to actually bring that down to help put this more in alignment here. If we look at the lip itself, Sherry, again, we're trying to achieve that 1 to 1.618 ratio, which is, you know, sort of a Caucasian measurement, not necessarily for everybody. When I look at your ratio is fine, but that bottom lip is definitely starting to tuck in and we need to bring it out. You had expressed concern about the lines around the mouth. So when we go around the mouth with a little bit of filler, we're actually going to address sort of the anti-aging aspects of the lip. So I often tease my ladies over 40 and I say sometimes we want our lips done, but not for the purpose of augmenting them, just for making them look more youthful. So the last thing that we're going to look at, Sherry, is your cheek. So I'm going to do some measurements here where we draw a line from the corner of the mouth to the middle of the ear, and then we're going to draw a line from the outside of the eye, and then we're going to connect them. And this measurement gives us the cheek mound. So this is where the majority of the volume should be in the cheek. And as you already expressed, you're feeling like that's falling. And I can actually see that volume loss in through here as well. The last thing that I'm going to do is I'm going to draw a line right through our mound. And then we know with our caliper measurement, we can intersect that line and have the spot where the apex of the cheek should be. So this doesn't necessarily mean this is where we put all the filler. What we're trying to achieve is this is where the light should be reflecting off the cheek. And so often as women age and this falls, we're getting light reflection off of here. So we actually want to pull it back here. Now I do want to address the fact that you don't like these lines here. So by doing this technique where we pull this back here, and then bring this forward, that's actually going to soften that line as well. With the filler, I will also be putting product through here to tighten that as well. So Sherry, those are the 8 measurements that we use to determine where we need to lift and tighten and pull. So Sherry, the next step that we're going to do is you and I together are going to come up with a treatment plan. We have these great carbon copied pads. I'm going to write out a plan for you, including cost, downtime, all of those details. And then you actually go home with a copy of that, and we keep a copy in your chart just so that everyone on our medical team knows what you and I have discussed. Most of our patients, you know, we do these full in-depth treatment plans, and I always tell people it doesn't mean that you have to do all of that, okay? Everyone has a budget, and we're always working within somebody's budget, you know, keeping that in mind. Sometimes we need to go slow, you know, or sometimes people will just choose to do a portion of what we recommend. My kind of rule of thumb is that if we have a full recommendation to give you the result that you want, you know, if you want to choose to do less, that's fine, but then you also need to adjust your expectation down a little bit. So we're always just trying to meet halfway with our patients, making sure that their goals are met, you know, with working within their budget as well. So based on what you told me, we're going to start at the top here. I already talked to you about how this line is like a scar, okay? So it is quite deep, and I did mention I could put filler in there. We don't like to do that because it's a high-risk area. So we're just going to treat it with a neurotoxin, okay? We're going to use Dysport today. So give me another little frown. Pull really tight. Okay. So I'm going to use 25 to 30 units in that area. And then I'm just going to get you to turn away from me for a second and close your eyes and squeeze really, really tight. Good, and relax. So I'm also going to use some Dysport around here as well, because this muscle is pulling in and down. So if we can relax the muscle, we're going to open that up. The other thing that I want to use Dysport on you is on your jawline here. So when you did that expression like this, yeah, so you can see how, you know, bulky this muscle here is. So this muscle is attached to this band, and sometimes as we get older, it really starts to pull down. So we'll put a little bit of Dysport in there and see if we can relax that muscle a little bit. I might even put a tiny bit in your chin to see if we can drop the chin down. So that's the Dysport. So I'm going to write that out, and again, we'll kind of break it up so that you have an idea of each area, how much it costs, and how long it lasts. Now we're going to move on to the filler. So we did talk about possibly a little bit of filler in through here. Sometimes if women wear their hair down around, we don't necessarily treat this right away. I think the goal for you is really to get this beautiful lift in the cheek. I also want to put a little bit of filler. I'll just turn you away from me. I'm going to put a little bit of filler in through here and tighten this up, and that will give a little bit of a pull back here, and then we're going to fill in front of this line, and we're going to fill around the mouth. So I'm gonna write all of that out. And again, I'll write it out in sections so that if you decided you wanted to proceed very slowly, we could just do one area at a time. The other thing that we're gonna talk about is your eyebrows. So we've talked about the permanent brows. We're gonna introduce you to one of our permanent makeup artists, and she's gonna give you the most beautiful set of eyebrows. I can't wait to see those before and after pictures. They're gonna be awesome. And then the other thing that we're gonna do is I'm gonna introduce you to one of our skin specialists, and she's gonna talk to you about the photofacial, which we're also gonna try and get done in the next month while you're not tanned, before the summer season gets here. So we're gonna do that as well for you, and I'll write that on your home care sheet, and I'll make sure you go home with all the information that you need on all those treatments.
Okay.
If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.